Have you noticed a loved one showing subtle but concerning changes over the past year? It's easy to assume that death in old age happens suddenly. But the truth is, the body often sends quiet signals well in advance. These signs may appear months or even a year before life reaches its final stage. The challenge is that most of us miss these signals because they seem small at first. Only later, when looking back, do families realize that the clues were there all along? By then, it may be too late to prepare. But by recognizing these signs early, we can take meaningful steps to provide comfort, cherish precious moments, and ensure that the final stage of life is filled with peace and dignity. In this video, we'll talk about 5 key signs that can appear a year before a loved one passes. These may be things you've noticed, but brushed off as just aging. Others might seem insignificant, but actually signal the body's gradual decline. Understanding these signs early offers a chance to provide better care, create lasting memories, and ensure that your loved one's final stage of life is as comfortable as possible. Stay with us, because recognizing these signs can help you prepare emotionally and practically for what lies ahead. Let's dive into the 5 subtle signs. Number 1. Unexplained weight loss. One of the earliest and most significant indicators that someone may be approaching the final year of their life is unintentional weight loss. At first, it might be subtle. Their clothes fit a bit more loosely. Their belt needs tightening, but they just don't seem as interested in eating as they once did. Many people dismiss this as part of the normal aging process. But significant weight loss is often a warning sign that the body is struggling. It may indicate that the person is not absorbing nutrients properly, their muscle mass is diminishing, or their organs are slowing down. Aging naturally leads to some muscle loss, but when it happens quickly, it points to deeper issues such as malabsorption or protein deficiencies. Muscle loss leads to weakness, fatigue, and difficulty moving, which can also increase the risk of falls, compromise the immune system, and leave the person more vulnerable to infections. Changes in appetite are another contributor to weight loss. The body's signals to the brain to seek food may diminish, and food that once brought pleasure may no longer be appealing. This is a natural process as the body begins to shut down. Underlying conditions like cancer, heart disease, or kidney problems may also contribute to weight loss, while families often try to address it by encouraging more eating. If the weight loss persists, it is important to understand that it may be a sign of the body's final phase. At this point, comfort is key. Offering easy-to-eat foods and keeping them hydrated can be more helpful than focusing on large meals. If you notice significant weight loss in a loved one, especially when coupled with fatigue or difficulty staying active, it's time to listen to your body's message. Number 2. Profound fatigue and weakness. Another sign of the body's decline is extreme fatigue and weakness. This isn't just being a little tired after a long day. It's a deep, unrelenting exhaustion that doesn't improve with rest. Tasks that were once simple, like getting out of bed, walking across the room, or engaging in a conversation, become overwhelming. This is a result of the body conserving its remaining energy. As organ function declines, circulation weakens, and the body redirects its energy toward survival rather than activity. This often leads to longer naps, difficulty staying awake, and an inability to sustain normal activity. Emotional fatigue is also common. Seniors who were once independent and active may start feeling frustrated or embarrassed by their lack of energy. This can lead to social withdrawal, which only accelerates the physical decline. It's tempting to encourage someone to push through the exhaustion, but sometimes the best thing we can do is allow them the rest they need, offer comfort, and cherish the quiet moments. If your loved one is experiencing persistent fatigue that isn't alleviated by rest, it's likely a sign that their body is entering its final stage. This is the time to focus on comfort and quality rather than pushing for activity. Number 3. Increased confusion or withdrawal as a person nears the end of life. Changes in cognitive function can become evident. You may notice that a once sharp and engaged person starts forgetting things more often, struggling to follow conversations, or appearing confused in familiar places. These cognitive changes are often a result of decreased oxygen and blood flow to the brain. The person might become disoriented, forget names, or repeat themselves things that were once uncharacteristic for them. Emotional withdrawal can also be a sign. People nearing the end of life often stop participating in conversations, avoid social interactions, or prefer to be alone for long periods. They may seem detached, indifferent, or even moody. This is not a personality shift. It's the brain adjusting to the body's decline. For families, this can be heartbreaking, watching someone lose touch with the world around them. But it's important to understand that this isn't something the person can control. Instead of pushing for engagement, meet them where they are, offer reassurance, and stay present without expectations. When cognitive confusion or withdrawal sets in, it's an indication that the body and mind are preparing for the transition ahead. Be patient and focus on creating a peaceful, familiar environment for them. Number 4, frequent infections and slow healing. As the body's immune system weakens, infections become more frequent and harder to recover from. What used to be a minor cold or flu may now result in prolonged illness, or a small cut may take weeks to heal. Frequent infections, like urinary tract infections, pneumonia, or skin infections, are common in the final stage of life. The body's ability to fight back diminishes, and even antibiotics may no longer be as effective. Simple wounds can turn into chronic sores, especially in individuals with poor circulation. Chronic wounds, pressure sores, or infections are signs that the body is no longer able to repair itself efficiently. If you notice wounds that don't heal or infections that seem unusually persistent, it's a sign that the body's defenses are weakening. The key at this stage is comfort. For many families, there's a temptation to push for more aggressive treatments. However, focusing on hydration, skin care, and pain management can offer much more relief than extended hospital stays or repeated rounds of antibiotics. Number 5, changes in breathing and circulation. The final sign to watch for is noticeable changes in breathing patterns and circulation. You may observe that your loved one breathes more slowly or shallowly, or experiences irregular breathing with pauses between breaths. Sometimes the body's breathing rhythm becomes erratic, alternating between fast and slow breaths. This is often a sign that the body is winding down. Circulation also begins to slow, and extremities like hands and feet may become cold to the touch. This change happens as the body prioritizes blood flow to vital organs, while reducing circulation to less essential areas. The skin may appear pale or bluish, and the person may struggle with shortness of breath, even with minimal effort. In these moments, the focus shifts from fixing the issue to making them comfortable. Simple interventions, like keeping the room cool, offering water, or elevating their head to aid breathing, can provide some relief. As we reflect on these 5 signs: significant weight loss, fatigue, cognitive confusion, frequent infections, and changes in breathing, it's important to understand that these are often part of the body's natural process of preparing for the final transition. While this can be a challenging and emotional time, recognizing these signs early gives families the opportunity to focus on comfort, cherish precious moments, and make the remaining time as peaceful and meaningful as possible. When you notice these signs, instead of focusing on reversing the inevitable, focus on offering love, dignity, and comfort. Your presence and care can provide immense solace to your loved one as they approach their final stage of life. Thank you for watching, and if you found this video helpful, please like, subscribe, and share. Your support helps us create more content to inform and inspire. Take care, and remember to cherish every moment with those you love.